pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Thank you. Okay, public comment. Anybody with a public comment?
I think I'm on here.
Okay. Need approval of the minutes?
I'll make a motion to approve.
I'll second that, Mr. Chairman.
All in favor, signify by saying aye.
Aye.
Passes 3-0. Commissioner comments and committee reports.
Thursday morning, I had to miss my K.S.A meeting. Had doctor's appointments for my dad, but I did schedule in. I met with Becky Berger and Sean Rizzo on the sales tax issue, and we had lengthy discussion there. I had a meeting Thursday evening at Hiawatha for kneecap. Nothing new to report there, but a lot of board training and grant proposals, that type of thing. So.
I had a project concern meeting. Everything's going pretty good. We're proceeding to get the roof fixed at the F&M building, and we're at 200 meals a day is what we serve at our 2 locations, plus the Meals on Wheels. After that, I had a correctional meeting. There wasn't a whole lot of news coming out of that. And then I have adult advisory board meeting tomorrow at 11:30 for correction.
Yeah, everything. Les Lanner, you're on.
Good afternoon. Yeah. I have 3 POs for you guys today. The first one is for renewal of our Code Red system, which is the alerting system that both sends out weather alerts to our citizens, and then if we have any emergency alerts that we need to send out. And that's partnered between the county and the city of Atchison. And we use the MPG grant money to pay for the county section of that, and then the city reimburses for their section.
When you say the city contributes to it?
The city of Atchison contributes $2,460 towards that joint project. Sorry.
We'll just deal with these one at a time. The chair would entertain a motion to approve purchase order for $8,000 to Unsolved in Herman Beach, Florida. Have a motion.
I shall move.
I'll second.
Let's move to second. Any further discussion? Hearing none, we should be ready to vote. All in favor, signify by saying aye.
Aye.
Aye. Passes 3-0. Next case.
All right, the next one is for the county's antivirus program that we use, software. We use Trend Micro Worry-Free Service. This both does all of our computers in the county, and it's going to start on our email. We're going to change to that service from the Microsoft service for all of our spam filtering and virus blocking.
Questions for Wes? Chair will entertain a motion to approve a purchase order for $2,988 to CDWG for antivirus protection.
I shall move.
It's been moved.
Second.
It's moved and seconded. All those in favor signify by saying aye.
Aye.
Aye. Passes 3-0.
Okay, third and final one. That's for our VMware, which is what controls our virtual servers throughout the county. We are having to upgrade the license this year because with Microsoft or with Windows 7 and all those platforms end of life 12/31/2019, we had to upgrade to a newer license. So the total is $5,600, $5,608.18 for the newer license and for the yearly maintenance.
And you said this would go down next year?
Correct. So since we had to buy the new license, it was $4,000 more this year. Continued yearly maintenance is only $1,100 some odd change.
Chair will entertain a motion to approve purchase order for Converge 1 in the amount of $5,608.18.
I shall move.
I'll second.
It's
Moved and seconded. All those in favor signify by saying aye.
Aye.
Passes 3-0. That was pretty harmless.
You didn't get your maybe in your note.
Yeah, I didn't. You're right. These are all vital aspects to making sure that our whole county runs. So it's very important to stay on top of them.
Well, it was really good that you guys really play a vital role in the festival this weekend.
We did.
You did behind the scenes.
We had we expected for a far worse turnout than what we actually had. I mean, we expected lots of people with heat exhaustion this year. It was as hot as it was, and really everybody did a great job of staying hydrated, and we actually didn't transport hardly any at all. Most people were calm and stayed hydrated. There was less people that showed up to both events than normal, but that's expected with the heat that we had. So,
Do we need to sign? I heard that you gave free water. Free water at the.
Correct. The Salvation Army used some of the pallets that I got in for when we had our oil order this spring, and they used some of that water to pass out to the people out there at Lake Fest, and then I believe down the river also, just so everybody would stay hydrated.
So you didn't have to spend $3 to get hydrated.
Exactly. So, I mean, it was a great show. I wish it would have been 80 degrees like it is today.
Wouldn't it be wonderful?
But it was good.
The planning's very important. You pick the right dates.
Right? I know. I can just talk to Mother Nature a little ahead of time.
Okay, well, Roger's next on the agenda, but he's not here, so we'll let Andre.
Thank you, guys.
Thank you.
Thank you. Thanks, Wes. Are you guys? Sit back there. I have two board members with me today, John Jacobson and Jeff Shealy. So, and I have.
I thought John was up there looking for a job.
You think, look how casual he is. You never used to see him like this. I know.
We put you to work.
It's a good change.
I thought about wearing sport jackets. And go with dress up.
Can you build a bridge?
Yeah, I have them. Jeff, so this is my first piece too. That one. You can have that one. Yeah, this has minutes.
Okay.
And so I have. So since I've last talked to you guys, the county health rankings have come out, and so I wanted to just talk to you about that, bring the information to you. I don't have a lot, but I do have a few slides for you. So let's see. The first thing I wanted to talk about, kind of just to lay the groundwork, and I've said some of this to you all before, is what health is. And so you may or may not have seen this information before, but what makes up our health care? What makes up a person's health, basically? 20% of it is the health care that we receive or access in our system. 20% of it is your genetics. But 60% of it is what we call social determinants of health. And so those are the factors, those are things that happen outside of the doctor's office. The top two that affect social determinants that affect your health are poverty and education. So as an example, this shows us that those men that were born in 1950 and are in the top 10% of income earnings are expected to live to the age of 87 years. But those who are in the bottom 10% are expected to live around 74 years. So you can see there's a 14-year gap in those earning higher than those that are not. And regarding education, so the dark blue here is those individuals who have not graduated high school, and the light blue are college graduates. So you can see for men, there's about a 6-year difference. Those men who do not earn their high school diploma will be dying 6 years earlier than those men who graduated college, and for women it's about a 5-year difference. And so where does that kind of leave Atchison County? This is the 2019 County Health Rankings map, and the health outcomes is the ranking that we always think about when we say where do we rank. 2019, Atchison County is ranked 89th out of 102 in our health outcomes. So again, as I've told you guys there are two measurements that go into our health ranking. The health outcomes, which I told you we're at 89, and those include the length of life and then the quality of life. The next thing that is ranked or contributing to these measurements is the health factors. And those are what influence the health outcomes. So the factors include your health behaviors, the clinical care that we have available, our social and economic factors, and our physical impacts, our physical environment. So you can see on the on this graphic over here, policies and programs are at the bottom. That influences our health factors, which influences our health outcomes. And all of this on the right are the factors that contribute to our health, are the measures that contribute to our health factors. And so this is kind of where LiveWell works in these areas. No one else in the county is focused on these factors as they relate to health of the county. Obviously, we don't do it alone. We partner with a lot of organizations, as you know, the clinic, the hospital, our work sites, the schools, to affect change in those areas. But we're the only organization in the county that's focused on that systematic, long-term change that we know has to be made. So our traditional healthcare system is set up to be reactive. And Mr. Jacobson could support that or talk about that more. But our healthcare system is reactive. That's why there has to be a focus on prevention to really impact the chronic conditions that influence the health of our county. So that's why we at LiveWell work to focus on, for example, the schools' policies related to the health of their students or the health of their employees. Same thing for work sites. The evidence shows that if you focus on those areas, physical or policies, systems, and environments, those are the things that will make the lasting changes for a county. And so that's where LiveWell works. And this diagram right here shows you that. So more specifically, the health factors. That's where we're going to live, because that's where LiveWell Live Atchison can make a change, or can lead the county. So those are the things that create the health outcome. Our ranking for health factors, you'll see up there, in the whole state is 97 out of 102. Our health behaviors is 100 out of 102. So the orange here are things that are a negative trend, and that you can see adult smoking, obesity, physical inactivity. Here's access to exercise opportunities. So 74% of people feel like they have access to exercise, and 32% feel are not actually accessing those exercise opportunities or physical activity opportunities. The next slide is additional measures that fall into our health factors or health behaviors, and these are all things that that the county as a whole can address. There are specific ways that we can address these things, and I'll get to that in a moment. But LiveWell is the one that has our eye on this, and that reaches out to our community partners and brings this data to them and provides them with information and leads them to the changes that they can make in order to improve these numbers. This is going to take a long time, and we've gone up and down, but the one thing that if we can continue to kind of keep our heads down and keep focused on the areas that we know that work, this is how we can actually make a change. So, as I said, there are interventions that address these health factors, but before I get into that, this was a good quote I found in a presentation that I was at recently that kind of helps understand why policy is so important. So policy is the vaccine that can create resilience against chronic disease and those social determinants of health. So that kind of, to me, was a good summary, a good way to think of why policy is so important. And so when you go into the county health ranking website, you can click on any of those measures. So here I clicked on adult smoking, and it will tell you, here's a list of scientifically proven interventions, things you can do that will have a direct impact on this issue, on adult smoking. So some of the things that pop up under adult smoking: smoke-free policies for outdoor. Well, check, county led that. We've done that. You started it with the county tobacco smoke-free parks. The city has finally taken that and is tobacco-free playgrounds. statewide tobacco programs, and smoke-free policies for multi-housing unit. So as LiveWell is wrapping up a few initiatives where we've set our priorities to begin for kind of the next round of work, the next year of work that we'll be working on. And one thing that we have begun working on, and that will be our kind of next steps, is to partner with our multifamily housing units to bring tobacco-free living policies and practices to those facilities. I've talked to Sherry Swenson. She's very excited about this work and is looking to work with LiveWell to support her in making those changes within those units, because it's not an easy thing to do, and she's looking for the support to be able to do that, and we've had many discussions about that, so that will be a next step. We're also going to be convening a group of county residents to create a tobacco-free living work team that will create a countywide strategic plan on tobacco-free living. So we'll just look at how do we support youth in remaining tobacco-free, how do we support adults in becoming tobacco-free. Kind of a subset of that is prenatal smoking. So if you look at the county health rankings, one thing that is measured is low birth weight. Low birth weight has a lot of negative impacts on a child's future. And one of the reasons, so we have, I think, 8% of our babies in the county are born within the low birth rate range. If you break that down further, a vast majority of that 8% are African American babies. And a big indicator of prenatal or low birth rate is prenatal smoking. So that's an area we want to work with the health department and our CDRR partner. We've had conversations already to work on our prenatal smoking that we have in the county. So if you click on physical inactivity, here are some of the things that come up. Complete streets. This is something we've worked on, and there are policies and plans in place, and you can see throughout the city and that there have been measures taking place to improve the walking and the biking infrastructure. Exercise prescriptions. I've been working with Dr. Pam Rizza. She's created the content for an exercise prescription, and it has been designed now by our graphic designer, and will be going to the printer. I'm waiting for a quote back from her. So that we can provide these pads to our clinicians in the community. They will, and they are on board with this. They have asked, yes, we want this. So when your doctor tells you you need to eat more, eat better, and move more, they can also give you an actual physical prescription that says how much you need to move and ways that you can do that. So that's been a scientifically proven initiative that we are implementing within the next months. And so, really quick, but that's what I have for you today. I just wanted to bring kind of that health ranking information. I don't know if John or Jeff, you guys have anything else you want to add? I went kind of fast, but
You can read now.
yeah, I know. I was like, ooh.
You didn't mention environment.
Physical environment, like the
Included we have this committee.
yeah, yes.
And work with them to try to get this.
We have not. We have to take. We only have so much manpower, so we're really focused on those 3 areas I've talked to you about before. That is something that we need to have an eye on and put in our strategic plan to work towards in the future. I don't have internet access, but if you look at our environmental rankings in the county, I think we've made improvements in the water area, but I'm not positive about the air area. So I'd have to look at that. But at this time, we just can do what we can do, and so it's not on our immediate radar.
I think the specific metrics are clean air days. I don't think we really fall out of kilter compared to like state average. So a lot of times in those columns, you'll see like what the best practices are in that range, and then you'll see state and also other counties in like comparative size. So the water quality was a big issue before, and now we got dinged pretty hard in the rankings. The other rankings, the metrics like that change over the years, so it's really hard to track. You're trying to chase a rabbit. The best analogy I can make, just relating to you, is what LiveWell does. So think of like a road with like a ton of potholes. In the past, you go out and try and repair a pothole. That's really reactive. What we're trying to do is we're trying to get it so we have less potholes to repair over time, or in a best case scenario, no potholes, and somebody can drive across it. It's almost, trying to put that analogy, trying to make it like that, that's about the best I can say, because we're doing a lot of potholes. We're trying to fill a lot of stuff, and we're trying to prevent that from the future of trying to reoccur over time.
Right. It's a good analogy.
Not as many as we are.
That doesn't happen overnight.
Well, true.
Yeah.
Now, who compiles this data? Are you involved with the compilation?
No, it's a nationwide effort done by the Robert Wood Johnson Foundation and the University of Wisconsin.
Yeah.
Yeah. So every state in the county gets ranked. Their county, every state in the nation, their counties are ranked within their state.
So you're just to interpret and to bring a data forth.
Yes, and so in the past, when you click on that information, clinical physician to patient ratio, for example, this is one that we dispute the data on. You can click in there and understand. It'll explain to you where they're getting the data from. And then you can understand, okay, well, that doesn't count for our mid-level providers. So in this instance, it's not accounting for all the physician's assistants that we have. So I think at the very beginning of Live Well, you guys can correct me because I wasn't involved, there was some effort to influence the data that they were pulling because we knew locally it wasn't necessarily accurate. And I don't know how successful that was. However, what we can do, I think what we figured out locally is look at that data, understand those discrepancies because we know that. Yeah, identify that, but then still know we have room to improve and still use that guidance that the website provides, or they have tons of trainings and tons of resources to access. Still access those things that can be helpful to us to improve. But not, it's important for us to look at the data, especially our rankings. But I always say this to everybody, these guys have heard it many times. I don't want us to get too hung up on chasing that ranking because something could happen in another county that has an effect on your county. Now, we need to make changes so that we hang in the top half more than the bottom half, in my opinion. But to chase those rankings each year is a really like chasing a rabbit.
How many organizations in the county do you update regularly on this?
That I update on this or that we work with?
Both.
Both. That's a good question to count them. So like the schools, all the school systems, all the healthcare providers, the majority of the work sites. Then you have, kind of your community service organizations. We work with Project Concern. We work with the health department. We work with NECAP. We work with the YMCA. But I could sit down and make that kind of comprehensive list. The Boys and Girls Club. The other local. We work with the Effingham City Council. The colleges, Highland and BC. I could make that list and give you kind of a specific, but
I don't know if I need that.
Yeah.
But I was just kind of curious. Do any of them help fund you or anything like that?
Let's see. So a lot of when you're talking locally, funding is going to come. They help in other ways. Some of them, besides funding. So maybe they offer office space. Maybe they offer kind of in-kind support. Mm-hmm. Local funding would come from our local foundations and partners like that. But direct funding, yeah. Sure. No, I know where I'm going with that.
Mm-hmm.
Okay. This story goes back to 2010. We just moved into the new hospital in January of that year. I call it the best of times and the worst of times because I walked in my office about the middle of January, and on my desk was the first county health rankings report that I saw from the Kansas Health Institute. I said, what is this? I'd never seen it before. And I opened it up, and there we are, 105 out of 105. You mentioned earlier that now we're 102. Evidently there are
100.
100. Okay, so there are 5. So there are 5 counties that are not reporting right now.
Right.
But we were at the time 105 out of. In other words, we were dead last. We were dead last in the state for these kinds of behaviors and habits and just bad things and bad decisions that some of our population is making. I looked at this report and frankly, I was just sort of stunned by it. I suspected that we would have been probably maybe in the 75th quartile or between the 50th and 75th. I would have not expected us to be dead last. At that point, I recognized that we needed to do something. I approached Aggie Asher, who continues to be our Director of Social Services at the hospital, and Aggie and a group that she put together this incredible team. There were probably between 30 to 40 to 50 organizations that belonged to what was now is called Live Well of Atchison. I know we have an executive director, and so we're much more focused and much more driven. But back in those days, it was all volunteers and volunteer driven. People like Jeff who have stepped up early on representing the county and just did an awesome job, as did other people. But I was thinking about, we had businesses, we had the city, we had the county, we had schools, we had the hospital, we had the YMCA, we had the community health clinic, we had the EDC, we had advanced health services, and this initiative truly does take a village. It's broad based, and so as you look at bike paths and you see bicycles around the city and you see billboards that promote non-smoking for kids or underage drinking or teenage sex or whatever you want, whatever those behaviors happen to be, Live Well of Atchison is sort of the beacon, if you will, in the county that's taking this whole thing on. And the rest of us have our roles. The hospital has its role. The county health department has its role. The YMCA has its role. All of us have, all the physicians have their roles. The clinics have their roles. So all of us have specific roles. But Live Well of Atchison looks at the whole thing. Because of this information, this data, we're able to be 5,000 feet up, looking down, saying, okay, these are some of the opportunities we have, some of the policies, some of the directives, and the only way we get it accomplished is either through institutions, businesses, or government, because that's really where the real impact comes from, is in policy. And so why we're here today is because we need your support. This organization, we have made small incremental steps. I agree with Jeff. We are chasing a rabbit sometimes because the numbers can kind of go up and down. But I think, as Andrea said, my goal would be that we get in the below 50 instead of above 50.
Yeah.
And if we can get to that,
right,
then we're making real progress. But it takes, it's a marathon. It's not a sprint, and it's going to just take an awareness and education in the schools and the businesses, groups like advanced health services at the hospital that get involved in the workplace, creating healthy behaviors in those organizations. It truly does take a village, and I'm very proud of what this organization has done. I think we have laid some great groundwork, but the journey has really just begun. Is that fair?
That's right.
Anything else, Andrew?
What's that?
Anything else?
Nope. That's fine.
Thanks for coming in.
Thank you.
Appreciate it.
Thank you.
Appreciate your time.
You have any questions for us?
Oh, yeah.
Or anything you'd like to see that we're not showing? Okay.
Yeah. Oh, you're doing
Good.
Yes.
We want you to drive a little longer.
I wanted to eject it.
We want your information. We've already done it.
That's fine. There's nothing very exciting on this. Just more of that kind of stuff. Thank you all.
Thank you.
Roger.
Good time. Good timing. Was I late?
You could have been earlier. We just went on with that, so that's okay.
I'm here because last week we bid work on culverts in Atchison County. We reviewed those bids and we are recommending approval of the bids of Martin Construction and are asking that the Commission approve entering into a contract with Martin Construction for the repair of the 6 culverts, repair or replacement of the 6 culverts, as shown in the plan.
Is there a PO been prepared yet, or not, or does it have to be
in the contract?
I don't usually prepare a PO. I'm not the guy who usually runs the budget stuff, so I don't know if there's been a PO prepared, but there is a contract prepared here. And all of these documents, I emailed these documents out to all of you. All of these documents should be part of that contract because those stipulate what the work is that's being done. And the contract itself for signature, the amount is shown right there.
Was we going to throw in these Western culverts in that?
Not yet. Let me get all the quotes together and all the numbers together and do what I need to do, and then I will bring that back to you in a week, hopefully, as an addendum to this contract.
So the chair would entertain a motion to enter in a contract with Martin Construction for the amount of $49,610 for 1, 2, 3, 4, 5, 6 culverts, be completed within 90 days.
Yes.
I'll make that motion.
I'll second it.
Any further discussion? All in favor signify by saying aye.
Aye.
Passes 3-0.
Now, do we need to sign?
One of you will need to sign.
There's 12 through this one.
Yeah, either one. If you have 2 copies, then he can sign them both and keep one. And we'll hold on to these and don't give him one till he signs one for us.
Absolutely.
Thank you.
Thanks, Ryder.
And
That one goes to you then?
Actually, I'll have the clerks take care of that.
Okay.
Okay.
all right.
Thank you
I've
very much.
got all the unfinished business. Anybody have any? I'm aware of any. Patrick, County Councilor update.
I don't have anything.
Okay. Okay. So, any commissioners got anything else that we covered? The chair will entertain a motion to adjourn at 1:34.
So move.
Second.
All in favor signify by saying aye.
Aye.
Aye. We're adjourned.